Mr. Mateo Santos is a 73-year-old Hispanic male who lives at home with his wife Maria. He is of the Catholic faith. He and his wife have 3 grown children who do not live in the home. Mr. Santos stays active by walking and visiting with friends often. He currently volunteers at the local hospital assisting with restocking supplies for the units. Mr. Santos was a construction worker for his entire adult life. Because of this and natural age progression, he is experiencing hearing loss bilaterally. He does not wear hearing aids at this time, but understands they may be a necessity in the very near future. He does not have any allergies. He has a diagnosis of coronary artery disease, diabetes mellitus, diabetic neuropathy, and bursitis. He was diagnosed with diabetes in his 60s. He is taking Humulin R before meals and Lantus once a day to manage insulin levels between meals and during sleep. He takes gabapentin 3 times a day for his diagnosis of diabetic neuropathy, usually one when he wakes up, another early afternoon, and another at bedtime. He was diagnosed with coronary artery disease in his 50s, and he takes nitroglycerin for angina. He does receive cortisone injections periodically for the bursitis in his hips. He takes ibuprofen as needed, usually 3 tablets at a time in the morning or at bedtime for pain, but not every day. It is recommended that Mr. Santos have a clear understanding that we need to discuss end-of-life care and determine what type of care he would like to receive. Mr. Santos only has a living will, which does not include a provision to assign a healthcare decision maker in the event he becomes unable to make his own decisions. Therefore, I recommend that he obtain an advance directive that designates a healthcare power of attorney. Because of his Hispanic culture, this will most likely be his eldest son, Louis, although his wife is still living and his daughter is the oldest child. Because familialism is a characteristic of his culture, I intend to address this discussion with his family present to address their concerns, relieve anxiety, and have the family as a whole determine the best treatment plan. We will discuss exactly what medical treatments he would like to receive at end of life, and because he is Catholic, we will talk about any religious rituals that should be performed.